Picture this. You're sitting on the edge of your bed at 11 at night, and instead of drifting off to sleep, you're rubbing your feet together because they feel like they're on fire. Or maybe it's the opposite. Your feet feel like they belong to someone else, numb, distant, like you're walking on two pillows instead of solid ground. If any of that sounds familiar, stay with me for the next few minutes because what I'm about to share could genuinely change how your feet feel by the end of this week. Them, or that everyone's feet start acting strange after 50. But here's the truth, that wobbly, unsteady feeling when you stand up too fast, none of that is something you simply have to accept. Your body is talking to you. And today, we're going to listen. Spinal cord down into your feet and toes become damaged or irritated. It doesn't happen overnight, and it isn't caused by J fibers in your extremities. But it's far from the only cause. Poor circulation can starve your nerves of the oxygen and nutrients they need to function properly. Certain medications, especially long-term prescriptions for other conditions, can have nerve-related side effects. Vitamin deficiencies, particularly a lack of B12, can mimic the exact same symptoms. Even sitting too much, too often, without enough movement, can quietly contribute to the problem over the years. Deserve honesty, not empty promises. What I'm going to show you today is not a miracle fix. There is no chair exercise on earth that will regenerate a damaged nerve overnight. A physical therapy, research, and clinical experience actually show us consistent, gentle movement can meaningfully support our biology, but it can absolutely improve how you feel, how you move, and how confident you are on your own 2 feet. Equipment. They're gentle enough for almost anyone. They take only a few minutes a day, and physical therapists frequently recommend movements just like these for older adults dealing with foot and leg discomfort. But don't check out early. Biggest hidden contributors to poor balance and fall risk as we get older. So let's get into, before you do anything else, find yourself a sturdy, stable chair. Nothing with wheels, nothing wobbly. Ideally, one with a firm seat relaxed and pulled gently back, and both feet planted flat on the floor. Take a breath. Let. That's exactly what today is about. I'm going to walk you through 5 simple exercises you can do sitting right in a chair in your living room without needing a single piece of equipment. They're gentle enough for almost anyone, they take only a few minutes a day, and physical therapists frequently recommend movements just like these for older adults dealing with foot and leg discomfort. But don't check out early, because the exercises toward the end of this list target something most people completely overlook, and it happens to be one of the biggest hidden contributors to poor balance and fall risk as we get older. So let's get into it, starting with how to set yourself up for success before you even begin moving. Before you do anything else, find yourself a sturdy, stable chair. Nothing with wheels, nothing wobbly. Ideally one with a firm seat, and if possible, arms you can rest your hands on for balance. Sit toward the front edge of the chair with your spine tall, shoulders relaxed and pulled gently back, and both feet planted flat on the floor. Take a breath, and let your shoulders drop away from your ears. This isn't a race, and it isn't a workout in the traditional sense. It's a conversation between you and your body, and the goal is simply to move with intention. If at any point something feels sharp, painful, or dizzying, stop immediately. Discomfort from unfamiliar movement is normal. Pain is not. Your body will tell you the difference if you're willing to listen. Before we get into the movements themselves, it's worth understanding why this happens in the first place, because understanding the why tends to make people far more consistent with the what. The nerves running down into your feet are some of the longest in your entire body, stretching all the way from your lower spine to the very tips of your toes. Because they're so long, they're also more vulnerable. Any disruption in blood supply, any prolonged exposure to high blood sugar, any nutritional gap has more distance to travel and more opportunity to cause damage along the way. That's part of why neuropathy symptoms almost always start in the feet before they ever reach the hands. It isn't random, it's simply a matter of distance and blood flow. And that's precisely why movement matters so much. Every contraction of the muscles in your legs and feet helps push fresh, oxygenated blood down to those nerve endings, giving them a better chance to stay healthy and function properly. Feel more isolating than it actually is. Some people describe it as walking on sand. Others say it feels like wearing a sock that isn't there. Some describe an electric buzzing sensation that comes and goes with no clear pattern. Whatever version you're experiencing, know that it has a name, it has explanations, and in most cases, it has paths forward, starting with the simple movements we're about to walk through together. Let's begin with the first movement, and it's one of the simplest yet most effective things you can do for circulation in your lower legs. Start by keeping both heels firmly planted on the floor. Slowly lift your toes as high as you comfortably can. Hold that position for a couple of seconds, feeling the stretch along the top of your foot and the front of your shin, and then lower them back down with control. Now reverse it. Keep your toes pressed into the floor and lift your heels instead, rising up onto the balls of your feet as far as feels comfortable, pausing briefly at the top, then lowering slowly. Alternate between these two movements for about 10 to 15 repetitions on each side. This simple up and down motion does far more than it looks like it does. Every time you flex your foot this way, you're activating the muscles surrounding your ankle and along your lower leg, and those muscles act almost like a secondary pump for your circulatory system. In fact, your calf muscles are sometimes nicknamed your body's second heart because their contraction helps push blood back up toward your chest against the pull of gravity. When you spend most of the day sitting, that pump barely gets used and blood can pool in the lower legs, contributing to that heavy, achy, or numb feeling many people describe by evening. A few sets of toe and heel raises throughout your day can help counteract that stagnation and keep things moving the way they're supposed to. And once you've finished that first movement, let's move into something that targets a joint most people never think about until it starts giving them trouble, the ankle. Lift one foot just slightly off the ground and begin slowly rotating your ankle in a wide, deliberate circle, as if you're tracing the rim of a large plate with your big toe. Complete about 10 slow rotations in one direction, then reverse and do 10 more the other way. Once you've finished with that foot, place it down and repeat the entire sequence with the other ankle. The key word here is slow. It's tempting to rush through circles like this, but speed defeats the purpose. Moving deliberately allows the ankle joint to travel through its complete range of motion while gently engaging the small, stabilizing muscles that surround it, muscles that are absolutely critical for balance. Ankle mobility tends to quietly decline with age, often without anyone noticing until a small stumble turns into a serious fall. Because your ankles are essentially the foundation your entire body balances on, keeping them supple and responsive isn't a minor detail. It's one of the most protective things you can do for your independence as you get older. Now that your ankles and feet have warmed up, let's shift focus slightly upward to the muscles that support your knees, because knee stability plays a much bigger role in foot and leg comfort than most people realize. Sitting tall with both feet flat on the floor, slowly straighten one leg out in front of you until it's nearly parallel to the ground. As you do, actively squeeze the muscle on the top of your thigh. You should feel it tighten and engage. Hold that fully extended position for a slow count of 3 to 5 seconds. Then, lower your foot back down with control rather than letting it drop. Complete about 10 repetitions, then switch to the other leg. This movement strengthens your quadriceps, the large muscle group along the front of your thigh, which plays a starring role in everyday tasks you probably don't even think about. Standing up from a chair, climbing a flight of stairs, catching yourself if you trip. Weakness here is one of the quiet reasons falls become more common with age, because the muscles simply aren't there anymore to correct a stumble before it becomes a fall. And just like the earlier exercises, more active muscle tissue means more circulation, which supports the same nerve health we've been talking about from the very beginning. Next, let's bring in a movement that gets your whole lower body working together, which is exactly what real-world walking demands. Sitting upright with your back straight and feet resting on the floor, slowly lift one knee upward as though you're marching in place while seated. Lower it back down with control, then lift the opposite knee. Continue alternating left and right for about 1 to 2 minutes, breathing steadily the entire time rather than holding your breath. Seated, marching might look almost too simple to matter, but it's doing quite a lot beneath the surface. It engages your hip, flexors, your core, and your legs simultaneously, which mirrors the coordinated muscle firing pattern your body relies on when you actually walk. This kind of multi-joint movement also asks your brain and body to communicate more efficiently, which is a form of coordination training that becomes increasingly valuable as the years go on. Many physical therapists and on movements like this specifically because they train balance and rhythm at the same time as strength, all without putting any strain on the joints. And now, here's the exercise I promised you, the one that quietly gets skipped in almost every routine like this, even though it might be the most important of them all for long-term stability. Sit toward the edge of your chair with your feet flat on the floor, hip width apart. Slowly rise up onto the balls of both feet, just as you did during the heel raises earlier, but this time, once you're up, hold the position and gently shift your weight side to side, feeling the small muscles around your ankles work to keep you steady. After holding for several seconds, lower back down slowly. Repeat this 8 to 10 times. What makes this different from the earlier heel raise is the added balance challenge. Static balance, simply standing still without falling, is one thing. But dynamic balance, the kind where your body has to make micro adjustments while you're already off center, is what actually keeps you upright in real life when you step onto uneven pavement or catch your foot on a rug. This is the exact type of training that tends to get left out of basic exercise routines yet it's frequently the missing piece for people who feel unsteady but can't quite explain why. A few minutes of this daily can meaningfully sharpen your body's reflexive balance responses over time. Now, doing these movements correctly matters just as much as doing them at all, so let's talk about a few mistakes that quietly undermine people's progress. The first is rushing. It's human nature to want results fast, but fast, jerky movements reduce muscle control and increase your risk of strain or injury. Every one of these exercises works better and more safely when performed slowly and deliberately. The second mistake is holding your breath, which people do more often than they realize, especially during the hold portions of an exercise. Holding your breath spikes blood pressure and starves your muscles of the oxygen they need to work efficiently. So make it a habit to breathe steadily throughout every single repetition. The third mistake is expecting overnight results. If the sensations in your feet developed gradually, over months or even years, it's unrealistic to expect them to resolve in a week. Consistency, not intensity, is what actually produces change over time. And finally, never push through sharp or severe pain. Mild fatigue in the muscle is a normal part of exercise. Sharp pain, sudden weakness, or numbness that worsens during or after movement is not normal, and it's a signal to stop immediately and speak with a healthcare provider. A question I hear often is how frequently these exercises should actually be done to see any real benefit. There's no single perfect answer because every body responds a little differently. But a good general target is once a day, ideally at a consistent time, so it becomes part of your natural rhythm rather than something you have to remember. Many people find mornings work well, since gentle movement first thing can help wake up circulation after hours of lying still overnight. Others prefer doing this routine in the evening, right before symptoms tend to flare up, as a way to ease into a more comfortable night's sleep. There's no wrong time as long as it's a time you can realistically stick to. If 5 exercises feels like too much on a particular day, doing even 1 or 2 consistently is still far better than attempting a perfect routine occasionally and then abandoning it out of frustration. Progress. Here is built in weeks and months, not single sessions, so give yourself permission to start small and build from there. Another question worth addressing directly: can this replace medication, physical therapy, or other treatment your doctor has already prescribed? No, and it's important to be clear about that. Chair exercises are a complementary habit, something you layer alongside professional medical guidance, not a substitute for it. If you're currently under the care of a doctor or physical therapist for neuropathy, diabetes, or a circulation issue, these movements can absolutely be a helpful addition to that plan, but they work best in partnership with your treatment, not in place of it. If you haven't yet spoken to anyone about your symptoms, consider this video your gentle nudge to make that appointment, armed now with a better understanding of what might be happening and what questions to ask. Exercise is powerful, but it's only one part of a much bigger picture, so let's zoom out for a moment and talk about the daily habits that either support or sabotage everything we just worked on. The first habit worth building is simply breaking up long periods of sitting. If your day involves a lot of time in a chair or on the couch, try to stand and move around at least once every 30 to 60 minutes, even if it's just a short walk to the kitchen and back. Staying in one position for extended stretches allows blood to pool in the lower legs and can make numbness and stiffness noticeably worse by the end of the day. The second habit, especially important for anyone managing diabetes, is keeping blood sugar within a healthy, stable range. Elevated blood sugar over long periods is one of the most well-documented causes of nerve damage in the feet. So following your treatment plan, eating balanced meals, and taking medications exactly as prescribed isn't just about managing diabetes in general. It's directly protecting the nerves in your feet. Nutrition deserves its own mention here too, beyond blood sugar control. Your nerves rely on specific vitamins and minerals to function and repair themselves, and a diet built around vegetables, fruit, lean protein, healthy fats, and whole grains gives your body the raw materials it needs. Some people experiencing unexplained numbness or tingling are actually dealing with a vitamin B12 deficiency rather than diabetic neuropathy, which is exactly why it's worth discussing persistent symptoms with a doctor rather than guessing at the cause on your own. A simple blood test can rule in or rule out several possibilities in one visit. Foot inspection is another habit that sounds almost too basic to matter, but it genuinely saves people from serious complications. Get in the habit of checking your feet daily for cuts, blisters, redness, swelling, or any sore that seems slow to heal. This becomes especially critical if you have diabetes or reduced sensation in your feet, because small injuries can go completely unnoticed when nerve signals are already compromised, and what starts as a minor scrape can quietly develop into something far more serious before you even feel it. Footwear matters more than most people give it credit for as well. Shoes that are too tight can compress nerves and restrict circulation, while shoes that are too loose can throw off your balance and increase your risk of tripping or falling. Look for supportive, well-fitting shoes with a stable sole, and if you're unsure what's right for your specific foot shape or condition, a podiatrist can offer guidance tailored to you. And finally, know when it's time to stop trying to manage things on your own and reach OT for medical care. If numbness or tingling suddenly worsens, spreads rapidly, comes with significant weakness, loss of bladder or bowel control, difficulty walking, or follows an injury that warrants immediate medicals. Attention, not a wait-and-see approach. If symptoms are developing more gradually but persisting for several weeks, that's still worth scheduling an appointment for, because your healthcare provider can run tests to identify the underlying cause and recommend a treatment path suited specifically to you. And these chair exercises are a wonderful supportive tool, but they were never meant to replace professional medical care when your symptoms call for it. Let's bring this all together for a moment. If you've been dealing with numbness, tingling, burning, or a nagging sense of instability in your feet, please hear this clearly. You are not imagining it, and it is not something you simply have to live with in silence. These sensations are real, they're common, and in many cases, they're connected to identifiable, manageable causes like neuropathy, diabetes, circulation issues, medication side effects, or nutritional gaps. The very first step toward feeling better is exactly what you're doing right now, paying attention and taking it seriously instead of dismissing it as an unavoidable part of getting older. Today, we walked through 5 accessible chair exercises designed to support circulation, preserve joint mobility, strengthen the muscles in your legs and feet, and specifically train the kind of balance that keeps you steady and confident in daily life. They're gentle by design, but gentle doesn't mean ineffective. When practiced consistently, small movements like these compound into real, noticeable differences over time. You don't need a gym membership, expensive equipment, or hours of free time. All you really need is a sturdy chair, a few honest minutes each day, and the willingness to show up for your own health consistently. At the same time, keep your expectations grounded in reality. These exercises are a supportive tool, not a cure, and they can't reverse existing nerve damage on their own. What they can do is help you move better, feel more capable, and stay more independent while you work alongside your healthcare provider on the bigger picture. If your symptoms are worsening or starting to interfere with your daily life, don't wait it out hoping it resolves on its own. An early conversation with your doctor can make a meaningful difference in both diagnosis and treatment. So here's what I'd encourage you to do. Pick just one of these 5 exercises and try it today, right after this video ends. Not all 5, not a perfect routine, just one small, honest step. Tomorrow, add another. Small, consistent habits, repeated patiently over weeks and months, tend to produce the biggest, most lasting changes in how your body feels and functions. Stay active in whatever way your body allows. Eat in a way that nourishes your nerves and muscles. Keep your blood sugar in check if that applies to you. Stay hydrated unless your doctor has told you otherwise. Choose supportive footwear and make foot checks part of your daily routine, the same way you'd brush your teeth or take your morning medication. Your feet have carried you through every single stage of your life so far. Every walk, every errand, every moment spent standing beside the people you love. Giving them a few minutes of attention each day isn't a chore. It's an investment in the years still ahead of you, in your mobility, your confidence, and your independence. If this video gave you something useful today, consider passing it along to a parent, a friend, or anyone in your life who's been quietly dealing with numb or tingling feet and brushing it off as just another sign of getting older. Sometimes the smallest nudge from someone who cares is exactly what it takes for a person to finally take their health seriously. Take care of yourself, keep moving, and I'll see you in the next one.